Welcome to segment 4, where we'll be covering controlling a bleed. There are 3 types of bleeds: capillary, venous, and arterial. The least severe type of bleed is a capillary bleed. An example of a common capillary bleed is you fall down and you scrape your knee. Capillary bleeds are identified by bright red beads of blood and clear beads of plasma that ooze on the surface of the injured site. To treat a capillary bleed, clean the wound with antibacterial soap and water. Using hydrogen peroxide or rubbing alcohol to clean a wound is not recommended and can both harm the tissue and delay healing. Next, bandage the site. Clean the wound and reapply fresh bandaging every time the bandage gets wet or dirty. You want to keep the wound slightly moist and clean. Continue using bandages at least until a day or 2 after a scab is formed. The scab is your body's natural bandaging. The next level up in severity of bleeds is a venous bleed. Veins are often located close to the surface of the skin, which makes them not difficult to sever or damage. Veins primarily return deoxygenated blood to the heart and do so under a degree of pressure. Venous bleeds will be classified by dark red blood because it is deoxygenated that is dripping or pooling because of the venous pressure. The initial step is always dial 911 if you feel it is necessary. Simply dialing 911, however, will not be enough in the case of a major bleed. We must act quickly and efficiently. With severe uncontrolled hemorrhaging, a patient can suffer loss of life in as little as 5 minutes. Assuming that I have a first aid kit available in the home, I'm going to first locate my medical gloves and don them. Next, expose the wound site by removing clothing and apply direct pressure with your hand directly over the wound. Your vessels are like garden hoses in that they are cylindrical and pliable. Most of us have picked up a garden hose and pinched it shut to temporarily stop the water flow rather than walking back to the spigot. The same principle is relevant when applying direct pressure to the wound. The goal of direct pressure is to pinch the vessel shut to neglect blood flow to the damaged area of the body. Now apply direct pressure, this time using bandaging from your first aid kit such as gauze or combi pads. If a first aid kit isn't available, use an absorbent item such as a towel, rag, or t-shirt. You should always strive to use the most sterile bandaging option possible. With open access to the patient's bloodstream, any item placed over the wound that is contaminated can potentially lead to infection. If the initial bandaging completely soaks through with blood, do not remove it from the wound site. Instead, continue to add fresh bandaging on top of the blood-soaked bandages. Removing blood-soaked bandaging is likely to cause the clot that is forming on the wound to be broken. If the wound is in an extremity, being an arm or a leg, there are a few additional steps that can be attempted to control the bleed. If the wound is in the torso, the neck, or the head, continue to provide direct pressure with bandaging until help arrives. If bleeding in an extremity remains uncontrolled, elevate the extremity above the level of the heart. If the wound is in an arm, this can be accomplished from the laying, sitting, or standing position. If the wound is in a leg, the patient must lie down on their back so that the leg can be lifted. This is the principle of gravity working for us. It requires more pressure from the heart to reach a level above it than anywhere below it. We are attempting to reduce the amount of blood flow to the damaged site. The most invasive measure will be to apply a tourniquet to control the bleed. Patients that require a tourniquet will have a severe venous bleed or arterial bleed in a limb that was not controlled with less invasive interventions. It's important to make note of the fact that we always start with the least invasive intervention, direct pressure with our hand, and progress systematically to the most invasive measure, applying a tourniquet, if it is determined that the patient will likely not survive due to blood loss. Arteries primarily are responsible for supplying oxygenated blood to our body, most importantly our vital organs. Arteries require a significant amount of pressure to distribute oxygenated blood to the distal ends of our bodies, being the tips of our fingers and toes. Arteries move oxygenated blood every time our heart beats. Someone who experiences an external arterial bleed will have bright red, freshly oxygenated blood, spurting out under significant pressure every time their heart beats. Major arteries are predominantly cased further towards the interior of our bodies than veins and capillaries, and are protected by anatomy such as the skull, rib cage, spine, bones, and muscles. This makes the frequency of arterial bleeds less likely, although they are the most severe. Tourniquet application for a severe arterial bleed in the limb is imminent. Manual tourniquet demonstration. You will need a piece of material that is long enough to wrap a limb multiple times, is somewhat pliable, and a few inches in width. An elastic bandage from your home first aid kit is ideal. Other household items that can be used are a necktie or a cut piece of a towel, bed sheet, or t-shirt. A belt will not work for these purposes. The belt by itself, when wrapped around a limb, will never get tight enough to compress the artery or vein shut to control the bleed, which is the goal of tourniquet application. In addition to something to wrap the limb with, you will need a durable item that is easy to hold to use as a lever, the technical term being a windlass. Almost every household has silverware. A spoon is ideal since it doesn't have any sharp ends. Other household items that can be used are a screwdriver or a cut piece of a broom handle. A pen or pencil will not work for these purposes. These items are not durable and will likely break under the force applied prior to the bleed being controlled. Ensure that the side of the wound is fully exposed. Take your piece of material and pass it behind the limb 2 to 3 inches above the side of the wound. Do not apply the tourniquet directly over the wound, and do not apply the tourniquet over a joint. If 2 to 3 inches above the wound places you over a joint, continue to move the material up the limb past the side of the joint. A tourniquet should always be placed between the wound and the heart. Next, ensure that the two ends of your material are somewhat even before crossing them and passing them back underneath the limb once more. Tie the two ends using an overhand knot. This is the first knot you use when tying your shoes. Each time you wrap the limb or tie a knot, do so as tightly as possible. Take the item that you will use as a lever and place it directly over the overhand knot. Tie another overhand knot over the item used as a lever to secure the item in place. Once the item is secured in place, begin to turn the item clockwise. Continue to turn the item used as a lever until the bleed is stopped or you're physically incapable of applying any more force. Use the excess of the two ends of material to wrap around each side of the lever while leaving enough slack to tie one last overhand knot. Tie one last overhand knot over the item used as a lever to secure it in place and prevent it from unraveling. If a pen or marker is available, write the time the tourniquet was applied directly onto the tourniquet where it is visible. This will let the physician assuming patient care at the hospital know how long the limb has been without blood and oxygen flow. Once the tourniquet is applied, do not loosen it or remove it for any reason. If the first tourniquet applied fails to control the bleed, apply a second tourniquet just above the first. Combat-style tourniquet demonstration. Having a prefabricated tourniquet readily available for use in the case of a major bleed makes application quicker and more efficient. The components of a combat-style tourniquet are a self-adhering band, a routing buckle, a windlass rod, a windlass clip, and a windlass strap. Ensure that the side of the wound is fully exposed. Take the band and pass it behind the limb 2 to 3 inches above the side of the wound. Do not apply the tourniquet directly over the wound, and do not apply the tourniquet over a joint. If 2 to 3 inches above the wound places you over a joint, continue to move the band up the limb past the side of the joint. A tourniquet should always be placed between the wound and the heart. Next, pass the band through the routing buckle, pull tight, and adhere the band back onto itself. Begin to turn the windlass rod clockwise. Continue to turn the windlass rod until the bleed is stopped or you're physically incapable of applying any more force. Push the windlass rod under one side of the windlass clip and place the windlass strap over the windlass rod to secure it in place and prevent it from unraveling. If a pen or marker is available, write the time the tourniquet was applied on the windlass strap. This will let the physician assuming patient care at the hospital know how long the limb has been without blood and oxygen flow. Once the tourniquet is applied, do not loosen or remove it for any reason. If the first tourniquet applied fails to control the bleed, apply a second tourniquet just above the first. Rapid style tourniquet demonstration. Having a prefabricated tourniquet readily available for use in a case of a major bleed makes application quicker and more efficient. Rapid style tourniquets are ideal for young children and infants because they can conform to the tiniest of limbs. The components of a rapid style tourniquet are a cleat, a finger loop, and a running end. Ensure that the side of the wound is fully exposed. Take the running end and pass it behind the limb 2 to 3 inches above the side of the wound. Do not apply the tourniquet directly over the wound and do not apply the tourniquet over a joint. If 2 to 3 inches above the wound places you over a joint, continue to move the running end up the limb past the side of the joint. A tourniquet should always be placed between the wound and the heart. Next, pull the running end through the finger loop to make a hitch. Wrap the limb tightly with the running end until the bleed has stopped or there is no slack left in the running end. Secure the remainder of the running end in the cleat. Make note of the time that the tourniquet was applied and tell first responders when they arrive. This will let the physician assuming patient care at the hospital know how long the limb has been without blood and oxygen flow. Once the tourniquet is applied, do not loosen or remove it for any reason. If the first tourniquet applied fails to control the bleed, apply a second tourniquet just above the first.